So the system is based on alerts, and we're actually going to configure alerts. So here you have a screenshot of the Bora connector platform of Biosensi, where you can configure a number of alerts. At the top, there's the non-transmission alert, which is non-configurable because it's mandatory. You can't disable the leak alert, but you can configure the leak level of the alert, and then we'll add alerts on usage, AHI, respiratory rate, you name it. So, for example, here are the alerts we use as standard to get started. We say, well, I want to be warned. If the patient does less than 5 hours of NIV for 2 consecutive days, or if there's a variation in the use of his NIV, a 25% decrease or a 20% increase compared with the median of the last 15 days, for example, we can put an alert on median leaks, AHI, respiratory frequency, etc. And so what the nurse or the provider or the person in charge of screening the alerts is going to do, well, he's going to connect to the platform and he's going to see which patient has alerts. So these are fictitious names, don't worry. So I log on and I see that Regis has an alert, which is a usage alert. So I'm going to go into his file, see what's going on, determine whether this alert is relevant or not. To do this, I'll look at his usage over the last month or week, for example, and judge whether the variation is significant or not. So I'll have access to daily trends in the use of leaks, AHI, frequency, and so on. And then sometimes it's not enough, the daily usage. I want to dig a little deeper, especially if I observe that there are leaks. Well, I want to understand why there are leaks. So that's where I'm going to press the little AV button, which stands for AirView, and I'm going to connect directly to this patient's graph for such and such a day. And I'm going to be able to look at what I call the leakage profile. That is how the leakage is distributed throughout the night. And as you know, with this kind of graph, we can make a remote guess as to the cause of the leak or a set of causes, and therefore be able to better manage leaks remotely. In my opinion, this is one of the major benefits of remote monitoring, enabling caregivers to detect and manage leaks remotely.